Vanakkam, good morning. In this video, we are going to discuss about the coagulation. The normal hemostasis. Hemostasis means arrest of bleeding. It has the three important steps. First step is the vasoconstriction. Second step is the platelet plug formation. Third step is the clot formation. So if any injuries happen, first vasoconstriction occur, then platelet plug formation occur, third clot formation is occur. Normal fluid state of the fluid is due to the smooth vascular endothelium and nitrous oxide and prostaglandin is I2 is released from the endothelial cells that inactivate the platelets, and heparin bind with the antithrombin 3. Heparin is present in the blood. It combined with the antithrombin 3 inactivate the factor 295, and thrombomodulin combined with the thrombin activate protein C that inactivate the factor 5 and 8. These are the things important for the maintaining the normal fluid nature of the blood. The first step of the hemostasis is the vasoconstriction. That is mainly due to the release of the endothelin from the endothelial cells. It produces the vasoconstriction. And inflammatory mediators like leukotriene, histamine act on the nociceptor. It is also produces the vasoconstriction. And myogenic mechanism during the injury in the stretching of the smooth muscles produces the vasoconstriction. Second step of hemostasis is the platelet plug formation. So injury site is plugged by the platelets. So injury site is covered by the von Willebrand factor that attracts the platelets. So platelet adhesion and shape is changed, and the granule releases the ADP and thromboxane A2. It promotes the platelet activation and aggregation. Glycoprotein 1b is important for the attachment of the von Willebrand factor to the platelets. So glycoprotein 1b is important for the attachment of the platelet to the von Willebrand factor. Glycoprotein 2b3a is important for the attachment of the each platelets. Each platelet is attached with the 2b and 3a. So ADP and thromboxane A2 released from the platelet granules, that is stimulate the platelet aggregation. Thromboxane A2 and serotonin also important for the platelet aggregation. The clopidogrel is used as the antiplatelet drug. It is act on the ADP, inhibit the ADP. Aspirin also acts as the antiplatelet drug, that is inhibit the thromboxane A2, inhibit thromboxane A2. Abiximab is the glycoprotein 2b3a inhibitor. Last step of the hemostasis is the coagulation pathway or clotting mechanism. It has two pathways, intrinsic pathway and extrinsic pathway. The extrinsic pathway is the shortest pathway. Intrinsic pathway is the longest pathway. First they discover the intrinsic pathway, later discover the extrinsic pathway. Intrinsic pathway triggered by the endothelial injury. Exposure of the collagen is triggered the intrinsic pathway. We can demonstrate in vitro by take the blood and put it the blood in the glass tube. It is also trigger the intrinsic pathway. So in the enzymatic reactions occur. The inactive factor 12 is converted to the active factor 12. The active factor 12 convert the 11 to active 11. Active 11 factor convert the 9 factor to active 9 factor. Active 9 factor converted to the factor 10 to 10A, active 10A by the help of phospholipids and calcium and factor 8. Phospholipid is the injury site having the platelet phospholipids, that is the base for the forming the clots reactions. 10A converted the prothrombin to thrombin, and thrombin is converted the fibrinogen to fibrin. This is the common pathway. The extrinsic pathway in the trigger factor is the tissue injury that releases the tissue thromboplastin that activate the factor 7 to 7A. 7A is convert the factor 10 to 10A with the help of factor 3 with the platelet phospholipid and calcium that activate the 10A. 10A convert the prothrombin to thrombin with the help of factor 5, calcium and platelet phospholipids. Finally, thrombin convert the fibrinogen to fibrin. Insoluble fibrin to insoluble fibrin by the fibrin stabilizing factor that form the fibrin clots, arrest the bleeding. This is the final step, fibrinogen to fibrin. Thank you for watching this video. If you like this video, press the like button, share your friends. Those who are not subscribed to this channel, please subscribe. These videos briefly discuss the physiology topics. You must read the physiology textbooks. Thank you once again.